Evaporation. Evaporation may be defined as the free escape of vapor from the surface of a liquid below its boiling point. In practice, this process is very slow, hence liquid is boiled, causing vapor to be liberated in the form of bubbles from the bulb of liquid. Thus, a practical definition of evaporation is the removal of liquid from a solution by boiling the vapor in a suitable vessel and withdrawing the vapor, leaving a concentrated liquid residue. Principle of evaporation. Molecules of a liquid are always in constant motion due to the kinetic energy they possess, which increases with an increase in the temperature. The movement is, however, somewhat restricted due to the mutual attractions between the different molecules. Yet there are some molecules, especially on the surface, possessing enough kinetic energy to break the forces of attraction and escape into the atmosphere above it. Some of these molecules collide with air or other molecules of the liquid in vapor state and are forced to return to the body of the liquid. If the number of molecules escaping completely is greater than those returning to the liquid surface, the liquid appears to disappear in the form of vapor, and the phenomenon is known as evaporation. At a constant temperature, the vapor molecules above the surface of the liquid exert a constant pressure on the walls of the container, and this is known as the vapor pressure of the liquid. When the vapor pressure of the liquid above its surface equals the external pressure applied on it, the liquid starts boiling. At the boiling point, vaporization occurs both from the body of the liquid as well as from the surface, whereas below it, vaporization occurs only from the surface. Factors affecting evaporation. A number of factors including the following have been found to affect the rate of evaporation of a liquid. 1. Temperature. The rate of evaporation is directly proportional to the temperature of the liquid. Higher the temperature, higher will be the rate of vaporization, being maximum at the boiling point of the liquid. Although thermostable preparations can be evaporated at relatively high temperatures, due consideration has to be given to thermolabile substances like enzyme preparations, hormones, antibiotics, glycosides, etc. A temperature giving the fastest rate of vaporization but with minimum decomposition has to be chosen for such products. Otherwise, processes such as evaporation under reduced pressure or freeze drying have to be employed. Another alternative for sensitive products is the use of short exposure to a relatively high temperature, which may be less destructive than a longer exposure at a lower temperature. The evaporation can be accelerated by increasing the temperature, but it will cause decomposition of heat-sensitive principles of many drugs. Selection of the evaporating temperature also depends upon the moisture content of the material. Some drugs may decompose more readily in the presence of moisture, especially at higher temperature. Reactions like hydrolysis also take place in the presence of moisture. Hence, evaporation in such cases may be carried out at a low controlled temperature till a concentrated product is obtained, and the final drying may be carried out at relatively higher temperatures. 2. Exposed surface area. The rate of evaporation is directly proportional to the surface area of the evaporator, in which the liquid is evaporated. The larger the surface area of the evaporator, the shorter is the time it takes to evaporate the liquid. 3. Vapor pressure. If the aqueous vapor pressure above an evaporating liquid is increased, the rate of evaporation slows down. It is therefore essential to continuously remove the vapors above the liquid in order to facilitate rapid evaporation. This may be achieved by passing a current of air above the surface of the liquid. 4. Concentration. As evaporation of a solution proceeds, it becomes concentrated due to increase in the proportion of solute. This may result in the elevation of the boiling point of the solution, thereby increasing the risk of decomposition of thermolabile substances. The product may become viscous and solids may get deposited, hampering the heat transfer. Proper agitation conditions during evaporation may minimize the problem due to concentration. 5. Type of product desired. The selection of the method and the equipment to be used for evaporation depends upon the type of final product desired. Evaporating pans or stills may be used to obtain either a liquid or dry product, whereas film evaporators yield only liquid product. 6. Economic considerations. Economic considerations with respect to labor, fuel, flow area and materials are also important factors determining the choice of the method and apparatus to be used for evaporation. Provisions for solvent recovery and waste heat management also contribute significantly to overall cost reduction. Distillation. Distillation may be defined as the process of separation of the constituents of a mixture, including a liquid, by partial vaporization of the mixture and collection of vapors separately. Types of distillation process. 1. Simple distillation. It involves the conversion of a liquid first into its vapor, transferring the vapor to another place and then condensing it again into liquid. 2. Fractional distillation. Fractional distillation is the process of distillation employed for separation of miscible volatile liquids having different boiling points. If two miscible liquids are mixed together, each of the liquids acts as a solute for the other and lowers its vapor pressure. The pressure exerted by each liquid is known as the partial pressure. The mixture boils when the sum total of the partial pressures of both the liquids becomes equal to the atmospheric pressure. The vapors arising from such a mixture are richer in the more volatile component, which exerts the greater partial pressure. Now, if these vapors are allowed to come in contact with a large cooling surface, the less volatile component condenses and returns to the distillation flask, while the more volatile component passes over. This property is used in case of fractional distillation for separating two miscible liquids. The cooling surface is provided by a fractionating column, which generally consists of a long tube of wide hoe, either packed with materials such as glass beads, broken glass tubes, etc., or blown into a series of plates or spherical or pear-shaped bulbs. As the condensed liquid, consisting mostly of the less volatile component, flows down the fractionating column, it meets the fresh hot ascending vapors. During this meeting, the ascending vapors lose their less volatile component, which condenses and joins the downward flowing liquid, while the condensed liquid loses its more volatile component, which joins the upgoing vapors. The process is repeated at every point in the fractionating column, with the result that by the time the vapors reach the top of the column, they consist almost entirely of the more volatile component. The vapors then pass over to a condenser where they condense and are collected in a receiver. 3. Steam distillation. Steam distillation is generally used for the distillation of two immiscible liquids, one of which is water. It offers a convenient means of separating or purifying a high boiling water immiscible liquid at a relatively low temperature without inducing any decomposition. When two immiscible liquids are mixed together, they do not alter the properties of each other, including the vapor pressure. Each liquid therefore exerts its own vapor pressure independent of the presence of the other. The total vapor pressure of such a mixture is the sum total of the vapor pressures of the two liquids. The mixture boils when this total pressure equals that of the atmospheric pressure. The boiling point of each liquid is thus lowered and remains constant until one of the liquids has been completely removed. This property is used for distilling water immiscible liquids with a high boiling point at a temperature lower than the boiling point of water by distilling it simultaneously with water. Application of steam distillation. I. Steam distillation is widely used for the extraction of volatile oils like clove oil, eucalyptus oil, anise oil, etc. E. It is also used for the purification of thermolabile solvents and oils. Distillation under reduced pressure. Distillation under reduced pressure is generally carried out for thermolabile substances which are unstable and cannot be distilled at their boiling point under atmospheric pressure. A liquid boils when its vapor pressure is equal to the atmospheric or external pressure. The boiling point of the liquid may thus be lowered to the desired temperature by reducing the pressure on its surface. Drying. Drying may be defined as the process of final removal of liquid from solid material by thermal vaporization. It is a final stage of processing before a product is packed. A number of equipment's dryers are available for drying, and these usually vary according to the way in which heat is applied during drying. There include the drum dryer, tray dryers, fluidized head dryers, vacuum dryers, freeze dryer, etc. Application of drying. 1. Drying is an important stage during tableting by wet granulation process when the wet granules have to be dried before these can flow freely and can be compressed. 2. Techniques like spray drying are used for preparation of free-flowing and readily soluble drugs and drug excipients. 3. Drying helps in the reduction of the bulk of the material, thus facilitating easy transportation and storage. 4. Drying helps in the preservation of vegetable drugs which would otherwise due to microbial growth. 5. Crude drugs have to be dried properly before these can be ground to fine powders. Sterilization. Sterilization is the process of achieving a condition of sterility and may therefore be defined as the process by which all viable forms of life are removed or destroyed. Another related term is disinfection, which may be defined as the process of destroying all pathogenic microorganisms. It differs from the process of sterilization in that it is not an absolute condition of freedom from viable microorganisms. It may destroy infective vegetative agents but may not be able to kill resistant spores. Additionally, disinfection may not necessarily kill all microorganisms but will reduce them to a level not harmful to health. The important differences between sterilization and disinfection are presented here. Table 1.1. Differences between sterilization and disinfection. Sterilization. 1. It is the process of destroying or removing all viable forms of life. 2. It is an absolute condition and degree of sterilization is not possible. 3. Sterilization is capable of destroying even resistant spores. 4. Usually physical, chemical as well as mechanical methods are employed for the process of sterilization. Disinfection. 1. It is the process of destroying all pathogenic microorganisms. 2. It is an absolute condition and degree of disinfection is possible. 3. Disinfection may not result in the destruction of resistant bacterial spores. 4. Disinfection is usually carried out by the use of chemical agents. The processes used to affect sterility may be classified as A. Physical methods. These include the moist heat, dry heat and radiation sterilization. B. Chemical methods. It includes gaseous sterilization by ethylene oxide, formaldehyde etc. C. Mechanical methods. It includes filtration sterilization by membrane filters. Asterisk note, for details, please refer Appendix 1.1. Immunity. The term immunity refers to the capacity of the body to resist the effects of invasion of pathogenic microorganisms and their products. Immunity, in its microbiological sense, is the defense mechanism of the body to resist infection. Immunity may be natural immunity or acquired immunity. Immunity are two types: natural, acquired. In natural, species, racial, individual. In acquired are two types: active, passive. In active, natural, artificial. In passive, natural, artificial. Types of immunity: natural or innate immunity. The natural or innate immunity is the resistance to infections which an individual possesses by virtue of his genetic and constitutional makeup. It may be non-specific, when it indicates a degree of resistance to infections in general, or specific, when resistance is towards a particular pathogen. The levels of natural immunity vary considerably among species, races and even among individuals as to the age, sex, etc. 1. Species. Species immunity refers to the total or relative immunity towards a pathogen shown by all members of a particular species but not by another species. For example, all human beings are totally insusceptible to plant pathogens and to many pathogens of the animals such as rinderpest or distemper. Similarly, man is susceptible to plague but fowls are not. Typhoid fever is a serious disease in humans but mice are not affected by it. Race. Within a single species, different races may show different susceptibility to infection. This is known as racial immunity, an example of which is the high resistance of Algerian sheep to anthrax. In human species also, Negroes have a high resistance to yellow fever whereas white men are susceptible to it. Similarly, the Caucasian race is more resistant to tuberculosis than Negroes or American Indians. Individuals. The differences in the innate immunity exhibited by different individuals in a race is known as individual immunity. The two extremes of life carry a higher susceptibility to infectious diseases as compared to adults. Most of the children between 2 to 5 years of age are susceptible to diphtheria whereas most adults are immune to it. Some persons are more susceptible to colds and skin infections than others. 2. Acquired immunity. The resistance that an individual acquires during his life is known as acquired immunity. This immunity is essential since the innate immunity of a person is not adequate for protection against many microbial diseases. Acquired immunity consists of two types, active and passive. I. Active immunity. Active immunity is the resistance developed by an individual as a result of an antigenic stimulus. This involves the active functioning of the person's immune apparatus leading to the synthesis of antibodies and/or the production of immunologically active cells. Active immunity sets in only after a latent period which is required for the immunological machinery to be set in motion. Active immunity may be natural or artificial. A. Natural active immunity. This results from either a clinical or inapparent infection produced by pathogenic microorganisms. Persons recovering from clinically recognizable diseases are usually left with a high degree of immunity. In certain cases like diphtheria, smallpox and poliomyelitis, this may persist for life, while in other cases like influenza, pneumonia and gonorrhea, this is usually of a short duration. Sometimes, the invading microorganisms do not manifest clinical disease, yet the person becomes immune because his antibody-producing cells have received an adequate stimulus. Thus, a large majority of people in the developing countries possess immunity to poliomyelitis due to repeated inapparent infections with the poliovirus during childhood. B. Artificial active immunity. Artificial active immunity is the resistance induced by the administration of antigens, usually in the form of injection. The antigens used for this purpose are known as vaccines and consist of live or killed microorganisms or their products. On introduction into the body, they stimulate the body to form antibodies and immunity is acquired. E. Passive immunity. Passive immunity may also be acquired naturally or produced artificially. A. Natural passive immunity. Natural passive immunity is the resistance passively transferred from the mother to the baby at the time of birth. In human infants, the maternal antibodies are transferred to the fetus through the placental blood and confer immunity to the infant for several months. This explains why the babies are highly resistant to common infectious diseases including diphtheria, chickenpox, measles, etc. for the first few months of their life. It is only by about the age of 3 months that the infant acquires a satisfactory level of immunological independence. B. Artificial passive immunity. Artificial passive immunity is the resistance passively transferred to a recipient by administration of antibodies. The agents used for this purpose are the hyperimmune sera of animal or human origin, convalescent sera and pooled human gamma globulins. Such antibody-containing preparations are known as anti-sera, sera or immunes era. Tablets. Tablets are solid pharmaceutical dosage forms containing a single dose of one or more active ingredients with or without auxiliary substances. These are prepared either by compression or molding method and are intended for oral administration. Advantages of tablets. Tablets as dosage form offer several advantages including the following. 1. They provide an accurate, stable dose of the drug with least variability. 2. They permit administration of even minute doses of drugs. 3. They are easy to be swallowed or administered. 4. They are easy to handle and carry by the patient. 5. their manufacturing costs are comparatively low while the manufacturing speed is quite high. 6. Among the different dosage forms, tablets are the most stable with respect to physical, chemical and microbiological attributes. 7. Bitter taste and nauseous odor of medicaments can be easily masked by administering them in the form of coated tablets. 8. They are the lightest and the most compact of all dosage forms. 9. Tablets are generally the easiest and the cheapest to pack and transport. 10. Product identification is probably the easiest because of the variety of shapes and colors of tablets that are possible. 11. The release rate of the drug from a tablet can easily be tailored to meet specific pharmacological requirements. 12. They are attractive and elegant in appearance. Disadvantages or limitations of tablets. 1. Some drugs are difficult to compress into tablet form due to their amorphous nature or low-density character. 2. Drugs with high doses are difficult to formulate as tablet dosage form. 3. Bitter-tasting drugs and drugs with objectionable odor require special treatment like coating or encapsulation, which may increase the cost of the dosage form. 4. Drugs that are sensitive to oxygen or atmospheric moisture may also require special coating as well as costly packaging, which may increase the overall cost of the finished product. 5. Drugs with poor wetting and slow dissolution properties are difficult to convert into tablets, which will provide full drug bioavailability. 6. Drugs that are absorbed from the upper part of the gastrointestinal tract may also pose bioavailability problems if administered in tablet dosage form. 7. Drugs that are liquid at room temperature cannot be formulated in tablet dosage. 8. A major disadvantage with respect to convenience of patients is the difficulty of swallowing form, especially by children and critically ill patients. Tablets may be classified into a number of categories depending upon their formulation, route of administration, function etc. A simple classification is given hereunder. 1. Compressed tablets. A. Uncoated tablets. I. Single-layered tablets. E. Multiple-layered tablets. B. Coated tablets. Sad phase. I. Sugar-coated. E. Film-coated. E. Enteric-coated. IV. Compression-coated tablet. C. Chewable tablets. D. Dispersible tablets. A. Soluble tablets. Effervescent tablets. G. Sublingual tablets. H. Buccal tablets. I. Implants. J. Vaginal tablets. K. Lozenge tablets. L. Sustained-release tablets. 2. Molded tablets. A. Dispensing tablets. B. Hypodermic tablets. Capsules. Capsules may be defined as solid dosage forms with hard or soft shells of gelatin of various shapes and capacities, containing a single dose of active ingredient. They are intended for oral administration. Hard gelatin capsule shell consists of two cylindrical, telescopic pieces, cap and body, one end of which is rounded and closed while the other is open. These are made in a range of 8 sizes, with size 000 being the largest and size 5 being the smallest. The capsule shells are principally composed of gelatin along with small proportions of additives like water, plasticizer, glycerol, sorbitol etc., opacifying agent, etc. Advantages of capsule dosage form. Among the advantages associated with capsules as dosage forms are the following. I. They provide an elegant, smooth, slippery and easy-to-swallow shell for drugs. E. They effectively mask the bitter taste and obnoxious odor of drugs. E. They protect the medicament from the deleterious effects of atmosphere like air, light and moisture.